It is my honor to introduce Dr. Joan Lombardi, who is, I love this title, Joan. This is are you ready? Okay, it's the Deputy Assistant Secretary. This is the feds for you. The Deputy Assistant Secretary and Interdepartmental Liaison for Early Childhood Development in the Administration for Children and Families in the U.S. Department of Health and Human Services. That is, yeah. If only there was, I don't know, $100,000 for each one of those titles, wouldn't that be cool? Not likely. Anyway, I want to say to you that I've known Joan for probably 30 years, maybe, and have always been awed by her energy and her passion and her intellect. It is because of Joan's work back in the Clinton administration that we have an Office of Child Care today. She has been relentless in her advocacy on behalf of young children and has made the federal picture dramatically different from the way it could have been had we not had an outspoken, energetic, and passionate advocate like Joan. So Joan, it's all yours.
Excuse the title. Really, I come here as a often resident of Currituck County. And I don't know if any of you who's from Currituck County live here. I have the pleasure of spending as much time as I can get away in the Outer Banks of North Carolina, so I feel a kinship for the state, but not just because of that, but because of your work. I mean, when Stephanie asked me to come, I didn't think twice about it, because I hope I can convey with passion what you have done for the United States. And I mean that from the bottom of my heart. This is the cradle of early childhood, in my opinion, North Carolina. And I could just go down the list, whether it be health consultants, knapsack, teach, local state partnerships, public-private partnerships. I'm sure I'm going to forget something. You put it on the map. And so, you know, to come here, to celebrate you, to honor your work, and to continue to learn from you is really quite important for me. So I want to thank you from the bottom of my heart for your work and for letting me come here. I think when I do my few minutes of what we're doing at the federal level, you'll say, well, of course, because it reflects what you've done before us. And I think in many ways, many of the states have been laboratories for change, and the federal level is just catching up now with that. But I'm hoping what you'll see in these few minutes is that. So you've been relentless, and that's why I have been relentless. I was particularly happy to hear the health consultants conversation, because I am concerned what I'm hearing across the country is states cutting back on health consultants, which is the wrong direction, right? So to know that it's still alive and well here where it started, and all of Jonathan's wonderful work really has made a huge difference. So what I'd like to do is just spend a few minutes telling you the way we're thinking, and let's see if I can make this happen, about early childhood in the Department of Health and Human Services with our linkages to the Department of Education, because that's the way we're seeing it holistically across the two departments. This is the first time we've had an early childhood unit that crosses Head Start Child Care and other pieces and is planning systemically. And when I was coming to work the first day, I thought, what do I really, really want for children? And this is what I want. I want healthy, happy, and successful children. And I debated about whether I could use the word happy, because I was wondering if people would take me seriously. But then someone reminded me that the pursuit of happiness is part of the foundation for the country, so it's okay for us to say that. and joyful children. So these are the goals that we're being guided with, you know, healthy, happy, successful children, strong families, and increasing the number, particularly of low-income children that are in high-quality care. And, you know, I say that, and people are surprised that that's a goal, but what we see in way too many places is the opposite, right? That it's the most at-risk children that don't have access to the highest quality care, which seems upside down to me. Although I want all children to have that. So we've created this integrated child development, early childhood development piece, framework at the federal level. I have Head Start, child care, and what I call the emerging other, which are the interagency pieces. And I just want to mention a little bit about the interagency pieces because they're really the most exciting thing. But I want to mention a few things about Head Start and child care that we're doing. We're trying to operate them in an interoperable way. So the leadership teams across Head Start and child care meet together, the policy teams meet together, the training and technical assistance teams meet together, and trying to bridge across those pieces. We're also trying to bring in the state pre-K people, and I'll talk more about that in a second. But that's a new way of thinking, because when I came in, they were very stovepiped like this. And although the policies are still like that, we're trying to turn it and think systemically across those programs. And with the new programs that are coming online, particularly the home visiting, the new home visiting program. In Head Start, just a few announcements that you haven't seen. We've been very excited across both Head Start and child care, of course, that we put $4 billion of recovery funding out there. I know it's made a huge difference, and it is certainly our hope that those funds will continue. As you know, we're waiting for a budget, and we don't know where that is right now, but that is our hope. With Head Start, we just put out a proposed rule that we're going to be competing programs that are not high performing. This was a very hard decision, but the Congress gave us a mandate to move to competition, to redesignate some programs, and we think all programs should be high quality. So we're going to be competing about 25%, that's what the proposed rule says, of those programs that are reviewed annually. So that's on the horizon. We just created some national centers, one on teaching and learning, one on family engagement that we're very excited about. We're moving much more rapidly to talk about mentor coaches, knowing that what teachers really need are not workshops, but somebody that can provide them that ongoing teaching and support. And so we're trying to reinforce that. And we're trying to think in a new way about family engagement. We think family engagement, family support needs to be refreshed. And we're concerned that we have to scaffold families so that they can be involved in their children's learning instead of just assuming they're ready to be, when we know the stresses that children are under. So those are some of the things we're thinking about in Head Start and child care. We're very excited to try to continue to move forward with quality. We think the program's done amazing things on the access side, but we've got a long way to go on the quality side. We're happy that we now have an Office of Child Care that's parallel to Head Start and working in conjunction with Head Start. And we're moving forward to redesign our training and technical assistance, hopefully to design a new center for professional development and a center on quality and standards. So we're moving systemically across those programs. I want to spend most of my time, though, talking about the interagency piece. The way we're thinking about interagency work, we're thinking prenatal through 8. The frame of early childhood is really prenatal. The way we're thinking about it is prenatal to 8. So we're linking with health and home visiting on one side, and we're linking with education on the other side, although of course health and education cover the whole developmental spectrum. But the way we've organized ourselves are to we live in a health agency, so it's really important for us to link with CDC, the Center for Disease Control, the Mental Health Agency, all those parts, the Maternal and Child Health Bureau, which we're administering the new home visiting program. How many of you have heard of the new evidence-based home visiting program? New resources into the states, formula grants, to try to raise the number of families, especially at-risk families, that are getting home visiting. We think this is a very important part of what came out of healthcare reform. And so we're linking with the health side, and on the other side, we're really trying to make those linkages for the first time this deep with the Department of Education. Myself and Dr. Jacqueline Jones, who's the senior advisor to the Secretary of Education, have developed a partnership that we're working together to try to figure out how do we align our programs. On the early childhood side, they have Part B and Part C, special needs programs, and obviously Title I and all the programs that continue into the K-3 years. And we want to make sure, as we're doing horizontal alignment, that we're also vertically aligning our programs over the years. And we would like to see the states doing the same. Many states are, many states were ahead of us. So we're doing health and education, but we've got some other federal initiatives that I want to at least mention. We're working with the Department of Defense, and I see my friends from Oslo County here who do a lot of work around military issues. I know this is a state that has a lot of military families. We're very concerned with the servicemen and women who are returning and not able to use the child care that's on installations, but are using the community-based child care system, which we know is not the highest quality compared to what they may have been used to in the military child care system. So we've been working with the Department of Defense around that. We've also been working with other federal agencies to increase our focus on financial literacy for families with young children. We think families matter, and that family economic security matters. And in early childhood, if we get to the point where we think the answer is a program, I think we've missed the point. The answer is a combination of good programs and strong families. And so when we started out in this administration, I thought, well, what can we do? This was a time of tremendous economic stress on families. So we kicked off with this project called Assets, where we're trying to promote financial literacy for families, help them understand credit cards, how to use them, how to access individual development accounts, because many of the families, when you have young children, of course, you're at your lowest point financially, right? You're just starting out, so we think it's those families that really need to focus. That's part of parent involvement. It's that scaffolding to support families so they can focus on their young children when we know in this climate lots of families are struggling with basic needs and can't get to the point where we are now. So those are just some of the things we're making a concerted effort to link with our child welfare system. For all the Smart Start counties, executive directors here, I would ask you to make a special effort to make sure your child welfare directors in your counties are involved. We know that there are younger and younger children in the foster care system that are not able to access early childhood, and that we haven't done a good job of making those links. So we're anxious to do that, and we're working with the Children's Bureau around that. So that's just a glimpse of what we're doing at the federal level. Obviously, we're most excited about our state advisory councils. 45 states applied for recovery money, North Carolina being one of them, to create a state advisory council. I'll be particularly interested in how that emerges here, since you have had so many coordinated bodies at the state level, how your state advisory council fits with Smart Start and all the other initiatives that you've got going on here will be of particular interest. But 45 states now have been funded. We didn't get 5 states. There were 5 states that chose not to access federal money. But we're happy that most of the states are moving forward. And then finally, I just want to mention, we've been promoting this notion of early learning communities, which is really what Smart Start is. And so you can see how we're catching up with you. And because when Stephanie stands up here and said it's no, it's not a program, it's a system, that's exactly the point. We think every community across the country should have 4 things, all of which I'm assuming you have. One is a coordinated governance structure, which is, I think, what Smart Start gives us. The second is a data collection effort, and I think there still needs to be work on this, that says how are our kids doing at the population basis, not at the end of 3rd grade, but when they're born, at 3, at 5, and then at the end of 3rd grade. Unfortunately, in most places across the country, what do we know? We know what the 3rd grade reading scores are, right? And maybe we have some birth data, but it's a wasteland in between. And so here, I think you're ahead, but when I went around the room, I still saw gaps on data collection, and I don't mean this at the individual child level, I mean at the population level. How are our kids faring in a community across that? So you've got the pieces. Obviously, we need a quality assurance system at the local level that's working with the child care providers, and I think you've made a huge difference on that. And then those linkages with the schools. The whole country thinks you do ready school assessments here, and that you work with the K-3 community. And so I'm going to be anxious to hear today what's really happening here, what have you learned from your initial efforts. But let's face it, folks, if we think we're going to do it at 4 and turn kids around and then not do something around making sure they go into quality schools, we're just kidding ourselves. There's no magic bullet. We have to have healthy pregnancies, good 0 to 3 programs, and I'm anxious to hear what you're doing around babies and toddlers, because that also seems to be a gap area. Good preschool programs and then go into good schools. That's the continuum that we need to keep in front of us as we move forward. So we're trying to reinforce that. You created a vision, we're borrowing it and trying to expand it across the country, and I thank you for your vision.